Bismillahirrahmanirrahim. Assalamu alaikum and a very good evening to you all. It is a privilege to be here with the nursing community and other healthcare professionals, both local and international. And for our international partners, I would like to say I hope that you get to experience the sunny side of life before you leave. It has been raining crazy. Thank you for inviting me for the opening ceremony as well as the closing session, and most importantly, for allowing me to sit in one of your plenary sessions. I hope that the knowledge and expertise you exchanged during these 3 days and the synergy it created will help you to drive improvement in care experiences and outcomes, adapting your approach as needed to ensure you do your best in each situation based on evidence. Nurses and healthcare professionals are a huge community of practitioners who make an impact in people's lives, their health, and well-being every day. I cannot emphasize enough how much of a difference good nursing care means to patients. It is my wish that you use your knowledge, expertise, and compassion to ensure that your patients receive the best quality of care. That in turn leads to public confidence and pride in your profession. I want to reiterate Professor Gallagher-Ford's point on the role of leaders. Key leadership contribution is crucial to maintaining high standards and delivering change. This includes directors of nursing, heads of departments, medical directors, CEOs of hospitals, and policymakers. Leading change, adding value, set out shared ambitions and commitments that demonstrate leadership potential and the role you can and must play. As an educator, I am a huge fan of shared decision-making, and I have advocated for this in many forums, especially when it comes to children. My master's thesis on educational leadership and management was based on the topic, how school leaders involve students, teachers, and parents in decision-making. Hence, I would like to urge professionals and policymakers together to recognize the potential to manage the challenges of today and shape the future, whether it is evidence-based practices or on how to find ways to keep trained nurses in the profession or any other area in this field that needs to be addressed. Before I conclude, I would like to recognize the effort of Nurses Association Maldives and EBP Champions Maldives for taking the initiative to organize this conference on evidence-based practices themed from silo to synergy. I know it wasn't easy for you, but you did it. I also want to recognize, this is by no means disrespect to other participants or any contributor, but I want to recognize Dr. Fatma Shifaza's contribution to our nursing community in Maldives, though she no longer lives here. I hope that others who have migrated to other countries can take a leaf out of Fatma's book to give back to this community that they once called home. These are true examples of how everyone can influence and lead improvement, how we can be an agent of change, how we can be the change we want to be. Thank you.